Many people turn to Botox to get rid of sagging skin or wrinkles. It can also help with some medical conditions, but it may not be right for everyone. Dr. Kelly Burkenstock joins us today to talk about the pros and cons of Botox. Hi, Dr. Burkenstock.
Good morning.
Thanks for being here.
Thank you for offering to have me.
Yes, well, you know, Botox is so popular now. I recently did a story about how more and more men are using Botox.
Yes.
It's not just for women anymore.
That's
what are
right.
some of the pros of Botox?
Well, one of the wonderful things about Botox, if you wanted to try Botox and hadn't tried it before, it lasts about 3 to 6 months.
Okay.
So I guess that's also a con, but the lovely part of that is if it's something that you quite didn't bargain for, it's gone soon enough.
Now, obviously, it helps sort of soften the face,
Yes.
soften the skin, get rid of wrinkles. Is there a point in time at which you maybe can't fix a certain wrinkle, or maybe you're too old for Botox?
That's a great question, and on both of those questions, there's two different answers. Never too old for Botox, as long as you've got a tight, dynamic wrinkle that we can relax.
Mm-hmm.
The saggy, more creepy skin, where you may have lost a lot of elasticity over the years, that's not a good cure with Botox, because Botox is going after something that's too tight and sort of relaxing it. So if you've got a droopy, saggy muscle, that would be best handled by another procedure.
So how exactly does it work? I mean, obviously it's injected with a needle. Is it multiple different needles to handle different areas of the face, or do you have to just target certain areas of the face?
Sure. So we can do Botox over any part of the face that might be troubling you. A lot of people get worried about the number 11s or the commas in the glabella or frown region.
Okay.
And we just inject a small amount in a 3-point series here, and boom, the liquid magic takes over, and in 2 to 7 days it dissipates. Lots of ladies and men also worry about their crow's feet. And when we inject along the crow's feet bed, again, in a short period of time, it just relaxes that hyperdynamic wrinkle into a very, very soft skin tone.
I know I've heard the complaint that some people worry about it might give you sort of a surprised look, but that's not always the case.
That's not always the case, and if you're really watching the anatomy of the individual client you're working with, you shouldn't run into that at all. There are very experienced aesthetic physicians that do a very good job of this. If you may be using somebody that may not be quite trained so well, if you do hit the wrong muscles, yes, you can get the surprise look. But once again, if you then go back and have that physician or a more experienced physician tweak, you can certainly calm down that surprise look in a matter of a second.
Gotcha. Now, one of the cons, as you sort of already alluded to, this is only temporary, so if you want to keep that look up, you're going to have to continue to get injections.
That's right. Lots of people have their beauty or their Botox budget. Just like they save for their jewelry, they save for their Botox. But 3 to 6 months is a nice long period of time, and then you don't have to do it every 3 to 6 months. It may be a treat that you do every year on your birthday or anniversary.
Sure. What about some of the side effects? I mean, we've heard about these horror stories with droopy eyes. You were telling me there could be a drool problem with the mouth.
There could be. So if you hit the wrong muscle, which according to JAMA, which is a national medical magazine,
yes,
1 in approximately 3,333 patients will experience some sort of minor complication. Minor complication meaning if the wrong muscle were hit, you could get a slight droop or drool in the mouth area, or if a practitioner went too low on the forehead, you could get a little eye droop, a little eye sag. Those dissipate fairly quickly in the eye region. In the mouth, it takes a little bit longer. It can take up to 3 months to sort of self-correct.
Well, that's why it's so important to have a licensed doctor performing this to ensure you don't have any problems.
Yes.
Dr. Kelly Burkenstock, thanks for being here this morning.
It was a pleasure. Thank you for having me.
We appreciate it.